One of the things we realize here at Payer Compass is that there is no one-size-fits-all in healthcare. While reference-based pricing is an alternative self-funded plan model in of itself, we realize it's important to take that a step further and to provide even more flexibility and to accommodate the individual needs of each group. In the instance of Custom Inc., we collaborated with several key industry partners to create a recipe using our reference-based pricing solution named Innovate 360, and included upfront member advocacy and direct contracting to create their desired level of provider access, price transparency, and savings. This case study shows the future of their plan is bright and continues to result in some very rewarding outcomes.
It's a pleasure to be here today talking about Custom Inc.'s Live Well Health Plan. Custom Inc. is a custom apparel and gear company. We have about 1,500 employees, and the organization has been around for about 20 years. Custom Inc. has had a history of providing excellent health care for their employees. It's a self-funded plan over many years, and we've gotten many awards for one of the best places to work. So about a year ago, we embarked on a plan to be able to elevate our care, our medical plan, and be able to contain costs so that we continue to offer the kind of medical care that we had historically. So we embarked upon working with the Health Rosetta ecosystem with Risk Strategies to put together a program for the Live Well plan where we could provide the same type of benefits: zero deductible, low copays, excellent service through a reference-based pricing model. And we had a very tall order to fill. Our CEO wanted each individual inker, as we call them, to be happy with this change in our healthcare. And in order to do that, we needed to partner with some excellent folks to get that done. Because in addition to the traditional reference-based pricing framework with the Health Rosetta system, there was a desire to pre-negotiate and have what we call safe harbor providers, so that our inkers in various geographies would have providers that were contracted with the plan in advance. And Payer Compass played a key role in, prior to launch, going out and helping us be able to pre-negotiate with a lot of those providers.
Thanks, Carol Ann. Payer Compass has certainly enjoyed the last year working with Custom Inc. and all the other key players in this. What Custom Inc. set out to do is not your typical reference-based pricing program. Doing that much upfront negotiation, really forming a narrow network, a lot of hard work to get ready for go live, which was just March 1st. So we've been doing this a few months, but all of us played a key role. So everybody that had a relationship with a provider, we reached out, whether it was your advisor. Health Rosetta has some, Payer Compass certainly, but we've all reached out to providers in those very different markets, because your inkers are spread all over the country, to get high quality providers to come to the table and talk to us about contracting at a percentage of Medicare. So, and then we wrap it with just, plain RBP, I'll call it. So it's been a busy year, but I think we're off to a successful year. A lot of savings with the claims coming in. Any balance bills just now trickling in. I'm going to work those. So it looks like we're seeing about 62% savings to charges on the claims we've processed so far. Again, we just got started in March with a go live. So far the numbers look great.
And when you put in, it's about 10,000 providers, I think, that we have negotiated with. We were given a charge to try to get to 90% of previous providers, and we've gone well beyond that.
Excellent, yes.
And one of our challenges was pre-negotiating in different markets. So the Northern Virginia area, Dallas area, Reno, LA. And the Payer Compass outreach team did an amazing job. I remember sometime in November, We got a pediatrician in Texas, wanting to work with us before the plan went live. And I ran to Carol Ann's office and we did a high five. So, every pre-negotiated provider that comes in is like a huge win. It's like that first time. So we're really thankful for the Payer Compass team.
And another thing that was awesome about going through a transition, because any transition is hard. So we worked in conjunction with our partners, and Katie Sue was the really piggybacked a lot of this, but we identified what we called our VIP inkers and worked with Payer Compass and others to negotiate single case agreements for all of those inkers who had pre-existing conditions. And the attention to detail, in addition to looking towards those big, relationships, what Payer Compass did on an individual level for folks who had, an oncologist here or, a high-risk pregnancy was incredible. And oftentimes it's really the devil's in the details. And I would have to say that Payer Compass really has that attention to detail, which is behind the scenes. So when you talk to an inker, they may not, be able to say, who's Payer Compass? But it is really what they are, who kept the lights on and kept this really awesome plan running as we launched it right before a pandemic. Perfect timing.
With the Gunter Group, worked with Health Rosetta and worked with us on a change management process to really enhance the inker experience. That's what we call our employees, inkers. So having that assistance to help on the employer side to make employees happy was really beneficial.
Well, Carol Ann and Katie, thank you so much for your time today. I appreciate you sharing your story on how the new health plan for your inkers started, several first few months of implementation. Appreciate you sharing your story and your time today with us at the summit. Thank you.
Well, thank you, Kelly. It's been our pleasure to be able to be a part of this, and it's been a pleasure to be in partnership with Payer Compass through this journey, and we're looking forward to continuing to navigate and learn as we move into the plan for the following year, and hope to be able to see everybody in person next year.